Tetralogy of Fallot. This is the most common cyanotic congenital cardiac abnormality. This is the most common cyanotic congenital cardiac abnormalities. Now components of the Tetralogy of Fallot. Components of Tetralogy of Fallot. Number 1, ventricular septal defect. Ventricular septal defect. Number 2, pulmonary stenosis. Stenosis, narrow valve of the pulmonary trunk. Number 3, overriding of the aorta. This is overriding of the aorta. Number 4, right ventricular hypertrophy. Hypertrophy of the right ventricle, thickened muscle. Now clinical features. Clinical features include cyanosis, paroxysmal hypercyanotic attack. Cyanosis. Number 1, clinical features includes cyanosis. Number 2, paroxysmal hypercyanotic attack. Paroxysmal hypercyanotic attack. Number 3, easy fatigability and dyspnea on exertion. Easy fatigability and dyspnea on exertion. Sudden dyspnea. The affected child adopts squatting position until symptoms improve. Now, general physical examination. General physical examination. That means examination includes general examination of the precordium. General physical examination includes appearance, looks blue, cyanosis, skin, lips, mucous membrane inside the mouth, and nose looks blue. Then conjunctiva is congested, fingers and toes cyanosed, cleft finger, cyanosed and cleft fingers. Pulse and blood pressure normal, edema absent, anthropometry stunning. Anthropometry stunning. Precordium. On precordium examination, inspection may be bulge due to right ventricular hypertrophy. On palpation, apex beat normal, P2 not palpable, left parasternal heave is present, systolic thrill may be present at the left upper intercostal space. On auscultation, S1 is normal, S2 is soft and single, a loud ejection systolic murmur. On investigations, number 1, complete blood count, CBC, polycythemia. Number 2, ECG, right ventricular hypertrophy, chest X-ray, PA view, an abnormally small pulmonary artery and a boot-shaped heart. Then echocardiography shows ventricular septal defect, overriding of the aorta, right ventricular hypertrophy, then quantities of degree of right ventricular overflow, or outflow obstruction. Now treatment, medical treatment and surgical treatment. Medical treatment and surgical treatment. Correction of anemia. Correction of anemia. Treatment of polycythemia. Treatment of polycythemia. Symptoms of hyperviscosity may require phlebotomy or venesection. Treatment of polycythemia. Symptoms of hyperviscosity may require phlebotomy or venesection. Phlebotomy or venesection. Number 3, prevention of dehydration. Prevention of dehydration. Number 4, prophylactic antibiotic for infective endocarditis. Prophylactic antibiotic for infective endocarditis required for minor or major surgical procedures. Number 5, treatment of paroxysmal hypercyanotic attack. Treatment of paroxysmal hypercyanotic attack. Treatment of paroxysmal hypercyanotic attack. Paroxysmal hypercyanotic attack. Surgical treatment. All patients need surgical repair. All patients need surgical repair. Palliative shunt procedures are performed to increase pulmonary blood flow. Modified Blalock to seek or BT shunt. Palliative shunt procedures are performed. Palliative shunt procedures are performed to increase pulmonary blood flow. To increase pulmonary blood flow. Modified Blalock to seek or BT shunt. Modified Blalock to seek or modified Blalock to seek or BT shunt. Blalock to seek or BT shunt. Total corrective surgery. Early surgery is always preferred. Total corrective surgery. Early surgery is always preferred within 4 to 6 months of age. Total corrective surgery. Total corrective surgery. Early surgery is always preferred. Mildly cyanotic children who have had shunt surgery, total repair should be done. Mildly cyanotic who have had shunt surgery, total repair should be done. Total repair should be done 1 to 2 years after shunt operations. Now treatment of paroxysmal hypercyanotic attack or Fallot's spell. Treatments of Fallot's spell. Number 1, 100% oxygen by mask. Bicarbonate 1 millimole per kg IV to correct acidosis if present. Bicarbonate 1 millimole per kg. 1 millimole per kg IV to correct acidosis if present. Number 3, propranolol 0.1 to 0.2 milligram per kg IV, especially when severe spells and accompanied by tachycardia. Keep the child calm and unnecessary blood test and maneuvers should be avoided. Keep the child calm and unnecessary blood tests and maneuvers should be avoided.